the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today on the show, we have Michele Luckenbaugh. She is a patient advocate, and she wrote the KevinMD article, "The loss of a paycheck is a major traumatic situation. The loss of life is worse." Michele, welcome to the show.
Thanks, Kevin. It's an honor to be with you here today.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
I was born and raised in central upstate New York, went through the state university system there, graduated with a degree in secondary mathematics education, taught high school math for a period of years, got married, then moved to South Central Pennsylvania, where I currently reside, raised my family here. Everything was kind of going great in my life until, let's say, the year 2011, when I suffered a heart attack and was hospitalized. Certainly, I want to take a brief moment to thank my cardiologist, my primary care physician, nurses of cardiac rehab for getting me past that particular point in my life. And what so often is the case when somebody faces a kind of a life-threatening situation, they like to give back to those individuals that helped them get through that. And so what I've done, I've joined some health-related organizations as a result of that, one of which is the Patient Partner Program, which actually is a nationwide program. Its goal is to give the patient perspective, patient viewpoint to the practice that they are a member of. Sometimes as clinicians, as nurses, as staff, many of the procedures you do are done repetitively during the course of a day, during the course of a week. And through the eyes of a patient, there might be a better way to go about doing a procedure to a given patient. And it maybe at the same time making it a bit more efficient procedure. So that's one of the major things we do in Patient Partners. Another group that I became a member of was the Cardiovascular Family Patient Advisory Council. And over the years, we've done much in the line of feedback to my health system in terms of improving the care of the cardiac patient when they are hospitalized. Most recently, we've given our feedback on the construction of a new cardiovascular building, which we're all excited about. It's to open next year, 2021. And last but not least, certainly, is I'm a member of the Helping Hearts group locally. That is a group set up for heart patients. As a member of that organization for a period of years, I visited cardiac patients that were hospitalized, either pre or post procedure. And you know, Kevin, it's very important that I think a patient undergoing this situation receive some sense of encouragement that life can, in fact, be waiting for them after the procedure, and in many cases, it can be better than it was. And to be honest with you, many times when I finished my visits at the hospital, I left with, being so thankful for the conversations I've had. And so it's a very worthwhile group of people.
So you've written several KevinMD articles, and you're obviously involved with a variety of patient advocate groups. What are some messages and themes that you want to share with my clinician audience from the patient perspective?
I think one thing that I'd like to maybe emphasize is, coming from the standpoint of being a patient, let your voice be heard. If there's something of concern that's going on with you in your life, affecting your health, voice that to your physician. I know primary care office, somewhat the time is limited. Point out, come into the appointment maybe with certain key points that you wish to address to your doctor, so that the time that you do have with him or her, is wisely spent. That would probably be my key advice, is for all patients, is to make sure your story is heard.
Let's transition into your KevinMD article. The loss of a paycheck is a major traumatic situation. The loss of life is worse. Now, for those who haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
Well, if we go back to the month of March of this year, that's about the time when the pandemic, COVID-19, was hitting the United States, and specifically my state of Pennsylvania. At the beginning of it all, we were getting conflicting information over the TV news. And our president was telling us, and I remember that distinctly, this is something similar to the flu. It will come and it will go, nothing to be overly concerned with. And, initially I thought that was the case, but as you well know, and all your viewers are certainly aware of, here we are approaching the end of October, and at this point there's really no end in sight. There's approximately 215,000 people who have died from the coronavirus and approaching 8 million positive cases in just the United States alone. So until there is a tried and true vaccine that becomes available, which according to what I've heard, that's for the general public is not going to happen until sometime next year, we've got to do all within our power to protect ourselves. I was fortunate in that the state I live in, Pennsylvania, our governor took a very proactive approach. He closed our public school systems down in March, so learning became virtual. He strongly recommended wearing a mask when we were out in public, social distancing, proper hygiene. We were given daily updates continually throughout this entire pandemic. And so basically he was following all the guidelines that were given out by the CDC. And unfortunately, not all the governors followed suit. And it kind of, to me anyway, seemed it was divided against party lines, red versus blue. The governors who were following the instructions from the executive branch seemed to be kind of taking a laissez-faire attitude with regards to the directives. And as a result, eventually we saw the numbers, the case numbers, the deaths in those states rising. So until fairly recently, the last couple of months, they've realized that, yes, it might be a good idea to follow the mandates that were given from the CDC. And again, mask wearing, avoiding large crowds, proper hygiene. I'm thankful. Not everybody, that dictate was not exceptionally popular in our state. I mean, there's a number of people to this very day that complain about the fact that they have to wear a mask, and that is a requirement in our state to enter any business. You have to be wearing a mask. But I'm thankful. I've agreed with our governor from the very beginning. Just like in a family, children will follow the behavior patterns that they notice their parents giving forth. And it seems in many cases that's what happened here with the governors in some of the states. The beginning of this pandemic was very stressful. And again, that caused me to kind of sit down and write this article. Health systems were left with a shortage of needed supplies, PPEs, testing supplies, ventilators, and the thought was, are we going to have enough ICU space available for the influx of patients? Now, hopefully, at this point in time, all the health systems have made an effort to build up their stockpiles. We're facing, coming this fall, not only the COVID virus continuing on with us, but also the flu. Mm-hmm. So that's a double whammy. And it's my hope and prayer that we're all well prepared for this.
Now, one of the biggest frustrations that we have from the clinician side is the mixed messaging, and you alluded to that earlier. You have one message coming from the federal government, and sometimes you can have conflicting messages coming from the CDC and public health officials and even various governors. Now, from a patient standpoint, how unified is the messaging that you're hearing in your community? Are you hearing different things as much as we are here on the clinician side?
Yes, and it's pretty obvious. At this point in time, earlier on, only essential businesses were allowed to be open in my state. Now, pretty much all businesses are allowed to be open. There is guidelines in terms of the percentage of occupancy that can take place in various places, retail stores, restaurants. But you will see, in going into a particular retail store, they will wear the mask because, again, it's mandated that they do wear a mask to enter a place of business. But you'll see people in some of the larger stores, once they're in, they'll have that mask pulled down, not worn properly, kind of disregarding the rules and regulations, so to speak. And to me, when I see that, I don't know, it strikes me as a sign of selfishness, because we were instructed not only wearing a mask protects to a certain degree you, but it's certainly protecting the people around you. So I don't rely upon, in terms of information, I don't rely upon usually social media. I will go to some trusted sites such as Kaiser Health News, Johns Hopkins University, Cleveland Clinic. Our own Department of Health in Pennsylvania has a very good website with respect to the coronavirus. And even my personal healthcare system on its webpage supplies data relevant to what's going on within the counties that it serves. Yeah, it does anger me when I see people out on the street or whatever kind of just disregarding what our medical communities are telling us. You know, the people that serve and have been serving on the front line in medicine, treating the COVID patients, out of simple respect, we should be trying to protect all of us by following those guidelines.
Now, when it comes to messaging, what are some of the things that clinicians can do better whenever we see patients who may get their information on their favorite television network that conflicts with what we say? What are some ways that doctors can convince patients that some of the things that they're reading on social media and some of the things that they're watching on television networks are in fact false? Are there any tips that you can give from a patient perspective?
Well, I might point out, probably in the past, I've kind of trotted into my primary care appointment and have brought up something that I might have come across on Google or other medical-oriented websites, and I'll pose that to my doctor. And I think it's all in the manner of which the physician presents the actual facts to that patient in front of you. I think, one thing I might say in terms coming from the physician is try not to have kind of a condescending appearance. Present the facts and say, well, there are so-and-so studies that actually say the following. So what you may or may have not heard, on a social media site isn't the beginning and end of the truth. Here's what the information is. It's certainly up to the patient to evaluate it, but hopefully that they will listen, to someone who's actually truly educated in that field.
We're talking to Michele Luckenbaugh. She is a patient advocate. She wrote the KevinMD article, "The loss of a paycheck is a major traumatic situation. The loss of life is worse." Michele, I'm so thankful you've written dozens of articles on KevinMD from a patient perspective. Now, what is your goal of writing these stories? You know that I have an audience primarily of clinicians. Now, what's the goal of writing stories from a patient perspective on a primarily clinician-focused site?
Well, to be totally honest with you, Kevin, writing has become, for me, probably right after I suffered my heart attack, it's a way of me relieving emotionally my stress. And again, this was the case with this COVID article specifically. And many times, I see what's going on in healthcare. I have one of my children who is actually involved in healthcare, is a family practice physician. So I kind of sitting on the fence between patient and what I know in fact takes place in the medical professions, and how much effort it takes to become a doctor, to become a nurse, any position within healthcare. So I would like to, and many times, give the patient's perspective. What are they noticing on the sidelines, whether it be on a specific health topic, a topic that is relevant to what I don't like to use the word providers. I think that is a misnomer name. What our physicians and nurses, physicians assistants are all facing in practicing medicine in this time and age.
Now, what's the number one tip that clinicians can learn from patients?
It probably relates to something I said a little while ago. Learn the ability to listen. Mm-hmm. Many times you can learn an awful lot about the story if you just give the patient the opportunity to say it. And there's things that may be going on in that patient's life that not only may affect them emotionally, but some of those issues might in fact be directly affecting their health. So it's maybe asking, one or two questions. And I think many physicians might be surprised that the floodgates will open up and you will learn quite a bit about that patient that's sitting, directly in front of you.
And my final question, Michele, what is your take-home message that you want to leave with the KevinMD audience?
Well, it would be this: whether your feet fit into the shoes of a physician or fit into the shoes of a nurse, a social worker, a store clerk, a garbage collector for that matter. If there's something that's going around about you in this world that doesn't seem quite right to you, that seems maybe a bit unethical, take some form of action. Write, for example, an op-ed to your editorial section of your local newspaper. Contact maybe your local TV station. Ask them to maybe do an investigative report on that particular issue. Write letters to your representatives in Congress. Write a letter to your governor. Heck, for that matter, write a letter to the president if it's something of a national concern. The point being is, don't be complacent. Don't wait for the other guy, to express this, because the fact is, you might say, well, for one thing, I'm one person. What's it going to matter? Well, I'm one person, Kevin. I'm sitting here with you today talking. The fact is, though, if you have an issue of concern, the odds are there's a whole slew of people concerned about the same issue. And together, there will be a loud clamor if we join our voices. And that's what's needed to reach the ears of those in power to consider making the positive change that we need in this world. And in terms of the late Representative John Lewis, make good trouble. And my final advice would be vote. We're in a especially important time. Whether you cast your ballot through a mail-in ballot or showing locally at your polling place, cast your vote. That's a great way to get your viewpoint across. And again, this year it's especially important. So please vote, everybody.
Michele, thank you so much for sharing your insight, and thanks again for being on the show.
Thank you, Kevin.